What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. It is January 19, 2024, and I'm busy working on my medical practice. I'm busy working in the urgent care here back in Los Angeles. It's January, so I suspect that me and my girlfriend will probably be here for a few more months. It's been nice. It's been nice being back. I have a local urgent care group that every time I come back to LA, they give me a bunch of shifts, and it's enjoyable. It's nice. It's nice being back in kind of like seeing patients in person. I was gone for over 6 months in Spain, and I think sometimes you miss that. You miss the direct interaction. I always ask myself, like, if I had millions of dollars, if I had $150 million in my bank account, would I still see patients, right? That's the common question I ask myself. Would I still build what I'm building, and would I still go and see patients? And every day that goes by, I feel like my relationship with medicine is changing. Now, if I ask that question, like, I wake up tomorrow and I have $150 million in the bank, what would I do? What would I not do? I know that I would love reading my books. I just love reading books. I devour them. So I would spend a lot of time doing that. I love rock climbing. My fingers are destroyed because of it. And I love going for a walk in my neighborhood. I don't think I'd make a lot of changes in that. I don't know if I'd go move somewhere crazy, big, try to be away from society and, like, what is it, homesteading, or what is it called? Living off grid. I don't think I have any desire for that. I do want to still see patients. I like the idea. I'm gifted with the skills of seeing patients. Not that I'm gifted, meaning that through the practice of medicine and many other people, many other physicians before me, I got this skill and I want to put it to good use. However, I probably would not go pick up extra shifts just so that I can make sure that I feel financially sound. But I would build this cash-based practice that I'm building. So I'm happy about that. Now, the initial iteration of my digital nomad health practice was to be something a little bit more posh, a little bit more upper echelon, charging more every month and, expensive hourly rates. Not because I wanted to be, an elitist. It was more so because I don't want to spend a lot of time with a patient and not feel like I was adequately reimbursed for it. And that, I think it's very easy to feel that way. Anytime you're building something of your own, you're building your own virtual medical practice, you're building your own hybrid practice, partly in person and partly online, you're gonna be faced with this question. Like, is this the kind of work that I'm enjoying? And how much does it drain me? And is it making me enough money? From my fellow physicians and from other people who are not in medicine, I hear a lot of arguments as in, hey, this idea of doing cash-based medicine, you're living in cloud nine, you're living in the clouds, not on cloud nine. You're living in the clouds. You think that there's this idea that you can do everything by cash and you can completely forego the insurance system. All right, I agree. I think that's a little bit too idealistic, but it's really, really close to the real truth. When you think about the number of people who are right now caught up in the health insurance system, they can't afford their copays, right? They're getting kind of pinballed around from one clinician to the next, one specialist to the next. They can't really go back to the previous doctor to ask follow-up questions. There's a very low satisfaction rate in general. And I wouldn't compare yourself to the average person, because if you're listening to this, you're wealthy, you're educated, and you have the means to navigate the healthcare system. When you don't, when you're a small business owner and you're sort of stuck going to a doctor and just getting one medicine after another, getting one test after another, not really understanding what it is that they're doing, you don't feel the empowerment part. And then when the question comes up, do you need the surgery? You're just going to be told that you do, because it's just easier than somebody sitting there for 45 minutes explaining to you how and why this slap tear on your shoulder could probably be managed in this other way, but this other thing could happen. So in the end, we just opt for, hey, yeah, you need the surgery. In the cash pay model, you get to spend a lot of time with the clinician. You get to go one-on-one with this physician, discuss all the options, and it no longer has to be the orthopedic surgeon, because even the family medicine doctor can look up all the relevant information and tell you that, your functional capacity is pretty good. Your range of motion is decent. You don't on the x-ray, you don't seem to have a lot of degeneration of the joint. So it might be okay to consider some alternative options. What I can do is I can send a consult to a good orthopedist friend that I know, or I can send you to a cash-based orthopedist that I know who's not going to just do stuff for you because it's going to be lucrative for them. We're going to get you a legitimate consult. Now, for me, as a private practice physician, as a general medicine doctor, I can use companies like Rubicon MD. I can use companies like eHealth, eConsult. It's through, I forgot the name, but it's another consultation company where it's physician to physician. And so what I'm trying to say is that from the clinic visit to the surgery, to the blood tests, to the medications, this is 98% of healthcare. This is 98% of healthcare. It is covered. Through the cash-based system, it is covered. You might say, oh, but a $15,000 knee surgery or $45,000 back surgery, that's way too expensive. Nobody can afford that. Okay, so if you're the kind of person who knows that a $45,000 surgery is somehow imminent, which I think is ridiculous, the chance of that is still very low. The most common surgeries, the reason they're so cheap is because they're the most common. The least common surgeries are very highly priced because they're incredibly rare. So for it to be profitable for the surgeon and the team and everything, it has to be priced a lot higher. I don't expect that every patient will understand that. I don't expect that even healthcare economists will understand that. But I do expect and believe that there are enough patients out there who understand that they would be interested in coming into this cash-based ecosystem, because that's how they work. Their lives revolve around buying things, selling things. They're entrepreneurs or they're whatever. They make business decisions for their company. So they're comfortable being in this space, understanding that, yes, this doctor seems to have a lot of resources. And that's probably one of the most important things that I think I'm accumulating as a direct care physician. I don't want to say direct primary care because that's not really what I'm doing, but as a direct care physician, building my own virtual private practice, I'm collecting a ton of resources. I'm learning that GoodRx, which is something I used to recommend all the time, has the shittiest prices, has horribly high prices. They essentially are trying to maximize the price by comparing it to a bunch of other places and picking the lowest one, but that bar is set so high that it is useless. When instead I can go to Cost Plus Pharmacy and a lot of other online drop shipping, drug distributors, and get that medication for a lot less for my patient. I already mentioned the surgery, and now with companies like Rupa Health and other online lab companies, I can get some pretty decent blood tests for very, very affordable prices. And because I'm charging cash, I'm gonna have a lot of time to sit with the patient and discuss those things, to discuss the results, to come up with decisions. And in fact, because I have so much time with the patient, I can actually help them avoid needing that test in the first place, avoid needing that medication in the first place, because we can spend the time together to discuss all the viable options, right? That's what patients don't get to experience in the traditional insurance system. I think the counter argument that I'll get from some specialists and some other physicians is that, yeah, what do you do when somebody needs like a chemotherapeutic drug, or they need a monoclonal antibody or some other crazy medication that's super expensive for their autoimmune condition, or they need extensive hospital stay or something along those lines. Again, I think there is the chance of something like that happening, and that can be very cost prohibitive. But even when you're admitted to the hospital, hopefully you or your loved one can still make health decisions for you if you forego insurance. But I don't think the idea is to forego insurance. The idea is to not use your insurance, to use your insurance the way we use, I don't use my home property insurance here in Los Angeles. I don't use it for anything. I just wait until something major happens. And that's hope. The whole point is I hope I never have to use it, right? So if I can deal in the cash-based system, not only am I foregoing all those extra costs that come up and drive up my health insurance, of course it will drive down health insurance as most people did that, but I also get to interact with physicians who are less likely to want to prescribe a bunch of medicines to me or do a bunch of surgeries. They're probably going to want to keep me healthy. That's probably the kind of doctors that go into this cash-based system. Now, I'm not even trying to convince I'm not trying to convince anybody, no physician, no patient, or anybody who's listening to this, that the cash-based system is better. The point is the cash-based system is here, and it's only going to grow as our healthcare expenses are going to go up. So what is it in it? What is in it for me as a physician who is just unhappy in the health insurance system? Now, don't get me wrong. I can continue working in a local urgent care here in Los Angeles as a per diem, make $130 an hour. So I can do let's say I do two 12-hour shifts a week. That's 24 hours. That's a ton of money. That's a ton of money. I could just sit there and do that. The problem is I won't like it. I won't enjoy it. I'm going to be burnt out. I'm going to have that disappointment in my career. I don't need $20-some thousand a year, $20-some thousand a month of income. I want something that's enjoyable and sustainable. And I think the kind of lifestyle I will have when I'm building something that I enjoy is also going to be different. And that matters to me. I also want to be the kind of patient in this economy who's going to have access to these cash-based systems. I had a great experience because there was a cash-based option for me with my hand surgery, right? And any other medical issue that me or my girlfriend or my friends have experienced that would not have been very good in the insurance system. And still, imagine all of that. Let's throw that out the window. What is, the patient who wants to not engage or not be part of the health insurance model, if they wanted to opt out of health insurance, they would have the option of doing something like cost sharing or crowdfunding. So there's Crowd Health, there's Sedera, there's Zion. Yes, they're all companies and businesses that are in it for the money, and they have some good things about them, but in the end, they're going to deny a lot of stuff probably. But they will cover things that the worst things that you can think of, right? That crazy traumatic accident, that heart attack, that stroke that you get admitted for. They're going to cover that all day long. That's going to get covered by companies like that. And you're not going to pay $700, $800, $1,500 a month. You're probably going to pay $160 a month, $200 a month. There's another argument to be made there. Because somebody like me who has the means is in this entire health insurance system, the Affordable Care Act is able to lower the cost for the people who are really poor, which is why we're able to give health insurance to the poor. I love that argument. I think that's a great argument. The problem is, if only I believed that the people who are getting that free insurance, meaning they have very low income, therefore the majority of their health insurance is subsidized, if those people were having better health outcomes because of it, I would be all part of that system, but it's not. It's the same thing, the same concept with taxes. I believe we should pay our taxes. I try my best to not do anything too shady shady. There's nothing shady about it. I try not to excessively minimize my taxes. I try to be a resident of the US. I try to pay my taxes because my money is also going to go to those who are homeless, who don't have economic stability. And so I know my taxes are going to pay for some really good public health, public service things. But my taxes are also going to go and pay for wars overseas. They're going to pay for, making cheap oil available for gas. There's stuff that also still irks me. But of course, I understand you can't expect perfection. I can't expect perfection. But if there are two alternative systems, if there was a system in the US where it says, hey, we're not going to give you any support and you have to do it yourself, but you don't have to pay taxes, great. Now that's an option. I can choose whether I want to do that. And I'm saying all of this because in a way there is this kind of wave that has to build, this ball that picks up momentum as it goes down that hill. And the only way that momentum is going to come is when more and more physicians are going to go down this route of starting their own virtual practices, starting their own cash practices, and building something that is completely their own, that is cash-based, and I can refer for cash, I can get this done for cash, I can get patient admitted for, and have them pay for their hospital in cash. Then we're going to have an absolutely incredible alternative system to the health insurance model. I hope that helps. I hope that's encouraging to you, and take care.